And I think a lot of what we will say actually will be said by you. We don't talk so much, we act much actually. So coming back to what we're here for, we're here to see how we can increase awareness on human papilloma virus. And human papilloma virus, obviously from the lecture, we see that it's a very important virus. And what makes it very important here is because it causes one of the most common cancers, especially in low and middle income countries, cancer incidences and cancer deaths. And that is cervical cancer. And why cervical cancer is also very important, even among the gynecological cancers and many other cancers actually, is because it gives us a window of opportunity to prevent it. It's a highly preventable cancer, really. And so why make it be the most common, for example, in gynecological cancers, it's responsible for more than 70% of cases of gynecological cancers. It's the most common gynecological cancer. And then by 2018, we're looking at it as being even the second most common female cancers, only second to cancer of the breast. So these are things that if you compare it probably with cancer of the breast and other things, you see that before you can detect cancer of the breast, for example, it would have grown, and in a lot of cases, there's little you can actually do. But for cervical cancer, before it develops, it gives you this opportunity to do something. So, and we can see that at least it has a cause. For most cancers, they will just say the no known cause. Very few cancers actually have known causes. Cervical cancer is one of them. We can have also hepatitis causing, primary liver cell carcinoma. So when you have such opportunities, it pains somebody, it pains us to see that something that we know the cause of gives us ample opportunity 15 to 25 years before it eventually gets to cancer. And then yet is the most common, one of the most common cancers killing our women. It's actually very, very saddening. So with that, most of us actually picked very keen interest in seeing how we can be able to play our little role in the prevention of this cervical cancer. And one of the things is what we're doing today, increasing awareness. Because there are modalities we can employ to prevent this cervical cancer. One of them is the picking up of the vaccine, which is, not so widely available, not so affordable. Like when he said he still can remember the 21,000, I still can remember the 88,000 naira I paid for the vaccine for my 3 kids. Honestly, I still can remember. All of them had three doses. It's really scary when you see these women lying on the ward and there's virtually nothing you can do. They don't have the money to pay for the treatment. They don't have the money to investigate, to even confirm the diagnosis is a problem. So, we really need to do a lot, at least at the primary level of prevention, and then secondary level where we can do something. If it's not available, it's not affordable, it's not accessible, then we are available, we are accessible. Is that not so? So we need to inform these women to come in to screen. Once you have been exposed sexually as a woman, you stand the risk of having human papilloma virus in your system, in your cervix especially. And we could see a carrier rate of up to about 42% of all the population, or even women of reproductive age. And that's quite a significant population. And if you can be able to screen and detect these cancers in these women, these infections in these women, even though there's a saying I keep telling my medical students, cervical cancer is the rare complication of a very common sexually transmitted infections. We know how it comes. It's very common. It's on almost every 42 women out of 100, and then by the time it persists, it now gives you, with the persistence now leads to cervical cancer. So we need to be able to pick up these women at these early stages of infection. And that's why you have things like the screening methods we have. The pap smear, for example, that we do. The pap smear has been here for decades, actually. And you could see that the story still has not changed. For the past 3 decades, we're still talking about cervical cancer topping the list, especially in low and middle income countries where they don't screen so much. What came up now, what is being advocated, the HPV DNA testing. That one too is also sampling from the genital tract, vagina, and the cervix. The cervix usually is accessible most of the times to the health workers, that when these women come in, you can actually examine the cervix and be able to take the sample. But for the vagina, the women can actually do the self-sampling, which is what we are advocating. But even with that, the HPV DNA is also not readily available like the vaccine we're talking about. I've not seen any HPV DNA done, for example, in this hospital, or even anywhere else. All the ones we have seen is research. We get our kids, run them, and then do research, find out what the serotype or the genotype of the HPV is. But we've not been able to use them as screening tools in Nigeria, widespread screening tools. So what we started with and what we're still using is the papilloma virus, pap smear. So the pap smear gives us the opportunity to be able to take the cytology, that the cells of the cervix, from the fluid in the cells of the cervix, and then we can be able to examine and see. And furthermore, from there we could take it up. Any positive sample can be further evaluated. Any positive patient can be further evaluated with colposcopy. We can identify lesions. We can take biopsies to confirm some of these pre-malignant diseases that have already been discussed, CIN1, CIN2, CIN3. Once you've been confirmed that you have some of these things, for some of them, like the CIN1 and 2, we observe. For those that have very good health-seeking behavior, because for those that even don't have very good health-seeking behavior, I advocate treatment, especially if they have other risk factors which we also have seen. Because if you have the infection, you can clear it. But if you have some problems with your immunity, things like HIV positive patients, things like diabetes patients, things like patients on some form of chemotherapy or for some form of steroid therapies, immune suppressions and things like smoking, and people with high purity, some other risk factors like high purity, like use of contraceptive, other contraceptive, like hot contraceptive pills, and sexual behavior, those with high-risk sexual behavior, all these ones, by the time you talk to them and see how they go, and you're starting to get things like CIN2, you go to treat. You understand? So depending on, some of them we observe, some of them we treat, and once we can get 70% of these women that actually present to us with cervical lesions being treated, then we're actually on the roadmap to elimination of cervical cancer. But I remember what my chief told me. He said, when, of course, he saw all the things that we've been doing, trying to create access for women to screening, free screening, for example, treatment with LEEP, that's the loop excision, and then also of the lesions, and then also thermal ablation and cryotherapy. A lot of efforts have been done. He looked at me and said, you think you can prevent cervical cancer by sitting in the hospital? No. I can only do my bit in the hospital, but I know it takes collaboration. We have to collaborate a lot, because in the audience here, I can see some of my able midwives that we've been working in the state. You have to go out. This cervical cancer, all this is we're doing are actually opportunistic screening. Until they come, we cannot see them. And the ones that come to the ward with their cancers have never been to this clinic. They've never been to these clinics that we're talking about. They've never accessed all these screenings. They don't even know what you're talking about. So we can't be sitting here and be preventing cervical cancer. We can do our bit once they come, but we have to follow them where they are. Advocate, create awareness, screen, treat, give it to them, take it to them, not you wait for them to bring it to you. And then I think that's the only way we can be able to achieve complete elimination of cervical cancer by the year 2120. Thank you.